Hi, my name is Brittany Seal, and this is my presentation on substance abuse in pregnancy using methadone. Methadone is a Schedule II medication used for the management of opioid dependence and withdrawal. It helps people who are getting off of more hazardous street drug use, such as heroin, to avoid or minimize severe withdrawal effects. Initial treatment is generally followed by the slow tapering of methadone at a timed interval, which is highly patient-specific. Methadone acts on the same brain receptors as heroin and other opioids, producing similar effects. Because of this, it aids individuals with addiction to get off more hazardous street drugs. Methadone is a common treatment for opioid addiction and pregnancy. If opioid addiction is left untreated, then the baby can suffer from horrible consequences. Fluctuating levels of opioids in the mother may expose the fetus to repeated periods of withdrawal, which can harm placental function. Other harmful risks for untreated opioid addiction includes neonatal abstinence syndrome, stunted growth, preterm labor, fetal convulsions, and fetal death. It was difficult to find resources explaining any specific numbers for methadone use in my state of Pennsylvania, so I opted to review the numbers of opioid use and overdose to review the bigger picture on this crisis. In Pennsylvania, opioid use and addiction numbers have increased from 6.1 to 21.7 per 100,000 standard population from the year 1999 to 2017. In Pennsylvania in 2017, 1 out of every 37 hospital admissions were opioid-related. Nationally, opioid use and addiction numbers have recently begun to decline in 2018 to around 14,000 per 100,000 standard population. In Pennsylvania, opioid use was involved in 46,802 overdose deaths in 2018. This is nearly 70% of all overdose deaths. Nationally, opioid overdose deaths declined from 2017 to 2018, with 67,637 deaths reported. The use of methadone is typically pretty safe during the perinatal stages for the mother. Due to all the hormonal and chemical changes in a woman's body during this time, an increase in the dosage may be indicated. Methadone is generally safe for a pregnant mother if taken as prescribed. However, if a woman is misusing or abusing her methadone by taking an increased dosage, then it can increase the chance of the fetus having a low birth weight, premature delivery, stillbirth, or cesarean section. Methadone use in pregnancy can increase the risk of some fetal defects and disorders, but the pros of methadone use are greater than the individual continuing to abuse and use hazardous street drugs. Methadone use in pregnancy can provide a 3 to 5% chance of a baby having a birth defect. It can also increase the risk of a miscarriage or fetal demise. Methadone use can cause neonatal abstinence syndrome after birth, and it may increase the risk of long-term issues with behavior or learning for the infant as it continues to age. And methadone use can also put the fetus at risk for a low birth weight. Some subjective and objective presentations of a patient with methadone. Some subjective examples could include anxiety, irritability, vision changes, constipation, decreased libido, periods of drug abstinence, night sweats, and restlessness. Objective examples include skin marks from present or prior injection placement, shortness of breath, fever, weight loss or gain, withdrawal symptoms, current intoxication, liver disease symptoms such as jaundice, and affect changes such as a flat affect. Some differential diagnosis for this presentation. One diagnosis could be endocarditis, and that's an infection in the heart that causes an inflammation of the heart valves. This disease typically results from frequent intravenous drug use. Symptoms can include fever, fatigue, night sweats, shortness of breath, and a heart murmur. The second diagnosis could be cirrhosis, which is a scarring of the liver that usually occurs from chronic damage to the liver caused by hepatitis infection or abuse of alcohol. Symptoms can involve tarry stools, fatigue, weight gain or weight loss, shortness of breath, edema in extremities, jaundice, and abdominal swelling. And then a third diagnosis could be HIV. This is an immunosuppressing virus that decreases the body's capability to fight off infections. It can be transmitted through contact with infected bodily fluids, through sharing needles, or from unprotected sex. Symptoms can include fatigue, recurrent infections, weight loss, sore throat, and night sweats. And then prenatal care and monitoring for each trimester. During the first trimester for physiologic, it's important to obtain baseline labs to search for infections such as HIV and hepatitis. It's also important to screen for other STIs and treat them immediately if any results are positive. Demonstrate healthy diet guidelines to normalize labs and have healthy weight gain throughout the pregnancy. It would be important to obtain a normal urine drug screen from the patient, and it would be important to prescribe methadone or Subutex so that withdrawal does not occur and opioid levels do not fluctuate throughout the pregnancy. Psychological monitoring would include monitoring for denial and low self-esteem. It'd be important to provide psychiatric help if needed, help the patient to set their own treatment goals. Psychosocial monitoring would be assessing their support system, identifying if they have the financial needs to care for themselves and an infant, and provide housing services or women and children's centers. Legal factors would be to assess if the patient has any charges that are pending or currently against them, determine how this will affect custody of the infant. The second and third trimester basically have the same type of monitoring and evaluation. It'd be important to obtain labs for STIs for both the second and third trimester. It would also be important to obtain a urine drug screen in each trimester and before delivery. It's important to assess the patient is not malnourished and is gaining healthy weight during this pregnancy. For psychological, it's important to ensure patient is going to their individual or group sessions for therapy so that they have emotional support. Check in with the patient that they are staying sober and on track and following their goals. Assess if they're having any anxiety and depression. Some psychosocial monitoring would be to assess patient support system, see where they are living and if it is safe, see if they have a job or are financially stable. Legal factors would be to assess present or past charges against them, seek out if they will be serving time during the pregnancy or afterwards, discuss patient's legal rights for the fetus and what must be done to ensure custody with the biological mother after birth. And that is all. These are my references. Thank you for listening.